Great, wonderful. Welcome back to the third session of meeting the Innovator as part of the EIT Health Summit 2020. It would be lovely to be with you in person and meeting the Innovator in person, but we hopefully do that next year. And then we will have some news also on how it's going. Great to have you here. We were looking at a very interesting startup that was actually born during an EIT Health project. So the health movement project that won from 2016, 17, and 18 was being implemented with, it was led by the RISE Institute, the Swedish Research Institute. Karolinska was part, the Stockholm City Council, MSD as a company, and we had some others like the Catalan Agency for Quality, and we, yes, had also had a role in that. It was a very interesting project on looking into social impact bonds and how can we use tomorrow's money for today's healthcare challenges. And during that project, the Health Integrator was born, and Frederick, who is here today with us, has been taking that on. And you, with your background, you're very well placed for doing something as complex as the Health Integrator. Like you have a business administration degree, and then you worked for quite some time in the finance sector. So you bring in that experience from financing. You have then been working with the pharmaceutical sector, and then also with the RISE Research Institute. Before then, you started the Health Integrator, and you are now the CEO of the Integrator, and you will tell us all about what the Health Integrator is. We have also joining us, really happy that he could make the time, Chaps, who has been working with us on health movement, and has been working a lot on the social impact bond function. And so we have here also an expert that can tell us a bit how this works in Sweden, but also in other countries. But let's start with the Health Integrator. Frederick, the floor is yours.
Thank you, Magda. I will give a short presentation here and various comments and Q&A in the tool here. So if there are any questions, please write your question there and we get some interaction here.
Yeah, we'll write them in the Q&A, exactly. Yeah.
So thank you. Click here. Here. So this is Mats. He's a 60-year-old bus driver here in Stockholm who was part of a pilot study we did last year. So he have a few years left until retirement, and he wants to live an active life, traveling with his wife, renovating his house, etc. At the same time, he's very worried, ended up like some of his colleagues, where some are so obese that the safety belt in the buses are not long enough. So he knows why he has to do something, but don't know what he needs, where to go, who to meet, and how to get started. At the same time, we know that the barriers entering into the healthcare system are very high, so it would take a long time before he is entering into that, and if he would probably be regarded as still being healthy and be sent home without help. So there is a gray zone here where there are individuals in risk that are not taking care of the system that we are approaching with this solution. We know that 11% of Swedish GDP is spent on healthcare. It's before Corona, but still one of the largest industry within the society. We also know that 80% of that cost is related to lifestyle, means it can be prevented. And we're spending 99% of those resources taking care of people reactive. The value proposition we have, and this is calculated by Region of Stockholm, is that every euro spent on Health Integrator will give the region 2 euros back over a 5-year time period, which is a fantastic business case with 100% return on investment, which is quite rare within healthcare. Still, we know that the 2 euros are most probably 20 or 10 euros if you look at the indirect cost, because this is only calculated on direct cost of healthcare consumption. The challenge, however, is that the healthcare systems today don't have the first euro to spend on prevention to get the €2 back. And that's what we're solving here also with the financial service, to help the regions to actually finance the first euro to get the €2 and release the resources out of the system and transform it. So what we're doing here is an integration platform where the first step is to get a data profile with a health analysis of Mats. So he's doing a health check, he's doing self-assessment tool, blood sample, etc., to get the data baseline and building up the insights of his health. Secondly, he meet a health coach or health pedagogue who will build him up with knowledge and understanding of his situation. So he creating the user experience of having him making his own informed decision, which is the key here, not telling him what to do. That will result in a health plan with the actions, what's going to happen. Here, however, is the challenge how to make this happen. And what we have done here to overbridge that is that we have created a marketplace of existing services, solution, and products within physical activity, nutrition, stress, sleep, alcohol, or tobacco. So it's like a huge one-stop shop of preventive health services where Mats will be exposed for services and product relating to his data profile with the help of a health coach, helping him pick a personalized a unique personalized basket of services and product to improve his health. Secondly, we will follow him, we'll activate, support him, and evaluate this. So we also have the outcome of what this creates from a value perspective. So this method is validated in a pilot study that we did ending last year of 250 individuals, showing great result on all metabolic factors, but also keeping 93% of users called retention rate here on the platform, which is very, very high. And that was also to mention that it was also done with support from EIT and our partners that Magda mentioned here before, of course. So looking into what we're doing now in the region of Stockholm is that we have a target group, which here are pre-diabetics in 50 to 60 year old. The region have calculated what is the value of them or the cost of them becoming sick, meaning the alternative cost of not intervene with them. The region are today a large issuer of bond contracts, especially sustainable bond or green bonds, where they borrow a lot of money into the region using an underlying as a hospital building or something on those financial contracts. What we're doing here for the first time is that the underlying of these contracts are the health outcome of this defined population. And the buyer of this bond are Skandia, who's one of the largest insurance companies here in Scandinavia, and pension fund. And the facilitator of this contract is SEB, who's one of a major bank who has facilitated this bond contract. The good thing about this is also that the pensions fund money comes from Mats and the other parts of those who are part of the target group. So for the first time here, we also build a financial sustainability around this, where we can use our own savings working as a working capital to improve our health, which also build a very different kind of sustainability around this from a long-term perspective, using our own money to actually improve our health and capitalize this market we're building. Those money then goes down to finance what we're doing here with the Health Integrator and deliver actually a digital vaccine, which is exactly the same. Vaccine is a very popular term nowadays when Corona is around. This is the same thing, that we have a validated outcome for something, we give that, but instead of a shot in the arm, you get the access to a digital platform here. So what we're doing here, if we look from a system perspective, is that today we have very much a traditional system and moving into an integrated system. Today, we are very focused on reactive, what have happened and when it happened, instead of, as we do here, look at the preventive and proactive side. Everything is validated on average, generic, instead of see what do exactly I need, the personalized thing. For example, the basket of a personalized basket where Mats trading a unique combination of things just to him, example of being personalized. The traditional system are driven by experts, and here is very much about the opposite: empower Mats with the knowledge, insight to make informed decision himself. Today is very much a reporting of what have happened instead of see what is the trend, what is going to happen, and use predictive analysis. And if we move into the financial side here, it's very much focused on the cost, assuming that resources are limited, instead of thinking, if we use the resources we have in a smart way, what values can we create? And the boundaries here is normally the time perspective, because today we are budget driven, meaning that everything is within normally a budget year, which are very hard to actually close the business case short term. And here we move it out to an investment perspective and see it from a long-term perspective of a 5-year time period instead. So here you see how we actually transform on a system level what we do here. So to put us on the map and summarize what we do, I mean, we are a combination of a fintech company, as you saw here, facilitating this, but also a health tech company, but also edtech company, educating the users and knowledge around the health, and moving the system from insurance perspective, meaning paying for something when it happened, and instead move it to insurance, saying what if we can ensure that people are not getting sick in the first place, and regulate the value and cost around that. So yeah, short introduction of what we do.
Thank you, Fredrik. Wonderful to see what out of these discussions and working groups and brainstorming sessions 3-4 years ago, that is now really up and running and live and doing. That's absolutely wonderful to see that. While 4 years ago we were thinking, oh well, let's change the world, let's really make a change in health systems. So this idea of using tomorrow's money for addressing prevention today is the social impact bond, has been also used in other settings. Maybe Shaps, you could give us just a quick idea on the work in the health movement project that we did, the work with the Stockholm City Council, but also with some other actors across Europe.
Yeah, great. Thank you so much, Magda. Thanks, Fredrik. Fantastic presentation. Great to see that you're still working on this, and I'm so happy that it's still alive and strong. The social impact bond is just a mechanism, as Fredrik explained. It's a mechanism to pay for outcomes. It's usually when we say we would like to save money by prevention, people say, well, we've got to invest first to save. Well, this is exactly where the SIB comes in. The SIB is a way of giving you that investment upfront and saying that if you can show that you're going to save and you're going to prevent, well, then you can give us the money back afterwards, and we'll take an extra bit of a cut of the prevention or the savings that you've made. There are other instruments for that as well now, trying to get to that outcomes, and that's what this is about. It's more about the outcomes and achieving outcomes and getting someone to pay for those outcomes. There are things like outcome funds and pay for outcomes, the social outcomes contracts that the European Investment Bank is promoting now. And in terms of the work that we have to do with this, I think the most difficult thing, which I'm pretty sure that Fredrik is still doing now, is raising awareness and getting people to understand that this is more than just an app. This is more than just a combination of services. This is actually a means to get to that outcome, and getting people to realize a different way of thinking is very, very difficult for that. This is literally system change, and that's the most difficult thing across Europe. And it's probably better in the north than in the south, but it's still it's a long-term game plan. This.
Very good. Thanks, Shabs, for giving us this overview. We had in the session, the plenary session today was actually on the digital transformation and also the the role of the regulator on the health insurances. And I kind of overheard that it was said that while it's really difficult to talk with health insurances on making a change and on putting innovation. What would you say of that, Frederick? What is the, how do you actually sell your idea to the, well, in Sweden is the public health service, we have the regional authorities such as the Stockholm City Council, but the Stockholm County Council, but with other health insurances, how actually you make the point, how you approach them, and are they open to listen to this change, the paradigm change in the health sector?
Yes, but I think first of all, what we're doing here is that, as you saw, we're building a digital business ecosystem here, but there are many different stakeholders. It's the users. I mean, if we can't engage the users and create values around the users, I mean, then there is no value to share in a financial model. So we must understand the different levels, how value is created and where value is created. And in this case, we're building an ecosystem of different stakeholders where everyone must have something to win within this ecosystem. Because if you're not the winner in one way or another, you will be falling out of the ecosystem because it's self-regulating. So that's very important to understand here. The second part, as Chaps said here, I mean, we do something trying to approach and solve the root cause of prevention, which is extremely ambitious. And that is also meaning it will take time. It's not something we solve overnight, but if we not start that journey, even if it's long term, we will never solve it. And I think here also EIT has a very important role to play, because today the investment structure is very short term, that you have like incremental innovation in a 2-year time period, but you're never reaching the root cause of a problem. Instead, you're patching and trying to fix the consequences of something instead of going to the root cause. And that's what we see here now also on a global level. That's especially, I mean, look in Asia, where some countries, big countries, have investment horizon of what is going to make us compatible within 15 to 20 years. And here I also see that the EIT have a unique role to play. What will make Europe competitive within a 10 to 20 year time period? And then you must invest in those long-term structural changes and start that journey today, because it will take time, but that's what we create huge value and make us be competitive within this time period as a region as well.
But then how do you survive as a startup? I mean, I'm thinking about Curework. So Curework has this fantastic vaccine that now they come up with for COVID, but they have been starting, or the initial idea was born in 99. So that is more than 20 years ago. And they say even today they don't make money. So they have actually a very good relationship with their venture capitalists and their funds that invest. That is a really promising idea. How do you do that? Of saying, look, well, we probably will not getting rich with this soon, but how do you actually maintain that very important or very difficult moment, no, where you not really get the return?
Yeah, I mean, all entrepreneurs know how it's a tough journey and this may be even tougher from many perspectives. So it's challenging, of course, but also that we need to find, and this is really the key, to find investors believing in what we're doing, get that support around us, and that from so many different perspectives. But you building a team of both team members within us, but also investors and so on, that really believe in what we're doing from a long-term perspective is really key thing. Then what we see is that, I mean, we have been struggling, it takes time, etc., and it's challenging from so many different perspectives. But over after a certain time period, you're reaching the tipping point where suddenly people start joining you and think this is great, and then some people join you, more people join you, etc. And that's really what a movement is about. So it's really tough to be in the front, as we have done here, being the front runner of the development. But also what we see now is that more and more people are joining us in this movement and moving in this direction, which is fantastic and really, really rewarding. So I think also from looking back over the years, I mean, this short-term time perspective of investment are very also quickly in the investor world moving into sustainability and impact and so on, because it's not just get return on investment very quickly, but it's also building another society in a long-term perspective. And that's why we can provide something really, really unique here. But it also demands someone who's mature on the other side being ready to invest in this.
Yeah, how do you find those people, and then how do you kind of partner up with people that can help you in selling this, no, convincing, no, that this is really something that will work, and that will probably be an element of any future healthcare.
No, and that's the hard work to really, I mean, meet people, find those people, find the ambassadors within the different organization who can be support those ambassadors who can also support us in this movement. And that's the tricky part, to find those individuals and also building a community around this to make it happen. And it takes time, and yeah, but still, when you get going, you also will get a huge momentum in this movement.
Yeah. Maybe on this might be interesting, Shaps, if you just tell us a bit about, Frederick mentioned the importance of EIT Health in making this paradigm change in health systems by supporting the PRED or the Health Movement project a few years ago. But they also supported an education project on that. Could you just tell us a bit about that? And that might be how could we continue, or how actually Frederick can actually participate now in promoting this system change, particularly as EIT Health has put one of the main goals is the moving towards health outcomes.
Yeah, sure. So we did a project that finished last year that took about 50 commissioners or procurement managers in some other countries to how they would build a social outcomes contract. So, we took them step by step to think about what kind of big outcome they want, and then how they can achieve that by using getting from outcome to outputs to inputs, etc. And I think that was one of the things we learned in the first year as well in the health movement project, that actually you needed something on the side, much more detailed, much more in depth, to tell these people. As one thing is to get them to raise awareness. You understand, oh yeah, this is a great idea, but how do I put it in practice in this whole infrastructure that I've got here that is not what we're trying to move to? And that's what we were trying to do with that project. And it's Frederick, we can put you in touch with all these people who came with these prevention ideas, like the healthy living and healthy aging and things like that. And maybe it's a way to start speaking to them and finding out, how far they would like to go with their project, or how far they have been.
Yeah. Like I remember there was this very interesting one from the Catalan Health Service, the Institute Catalan Salud, using working art with museum and art, exactly.
For mental health, which is
for mental health. So it's a very, very interesting project. So we definitely will be seeing more in this space.
Yeah, and I think also that's also to clarify that. I mean, we are not inventing the interventions itself. We are a platform for this. So I mean, the users will get a combination and personalized match of that as well, which is also a new element into this word. It's not just a one-size-fits-all approach here, which is important to point out.
Yeah, but definitely you make it happen. I mean, you have people with great ideas on one side and on the other, but actually bringing them together with a financing model that is actually working.
Market maker.
Yeah, we have a minute left, Frederick. What would you recommend to other innovators that would go particularly a way that is difficult, that is system paradigm changing the system? What would be recommendations from your side?
First of all, I mean, the time perspective here, I mean, keep on going. And I mean, even if it's take time, keep on going. That's one message. Also, as we discussed, keep on trying to find the ambassadors within the organization who can lead the development and be the front running respective stakeholder organization. I think that's really the key here. It's not about the hard facts, the platform, the technology, the legal stuff, or anything. We solve all of that. This is about the soft factor and cultural thing that will make this happen. And that's what takes time, and that's what's really making this happen, to create this movement around this.
Mm-hmm.
So I think that's one part. And the last one is also, we don't have all the answers when we get started always. So even if there are uncertain parameters in things, the only thing to find out is by doing things.
By doing, yeah. It's a bit what we have seen this year with COVID. No, we don't know, but we have to do. So it's like, I think that's maybe one lesson. One of the out of a bad situation or bad crisis, there's some positive thing that we can take in doing it. And I'm really admiring you, Frederick, that you have been pursuing that goal despite of some problems we had on the way, as we have seen. So congratulations to you. I definitely we will watch the space. I understood that probably the Health Summit will take place next year in Stockholm. So I hope we can make a kind of another session and see how you're doing. Do you have some numbers? That was one of the questions that we had. Do you have now better statistics on, does it really work? Even so, you said it's a 5-year span, but maybe we can already have some first outcome measures. Thanks a lot. Frederick, thanks Sharps for joining us. This was really nice. This was a great and interesting session.
Thank you, Magda.
Thank you very much.
Thank you.
Thanks,
and
Magda.
thanks to all
Frederick.
that attended the session. Thank you.
Thank you.
Great seeing you. Bye.
Bye.